Guys, happy Saturday. I'm sorry to not get to this last night. However, I want to talk with you. It's 10:46. Okay, I'm going to try to do this in about 15-20 minutes, but I want to talk about childhood and neurodevelopment disorders. And it's very important to remember 20% of children, and when we talk about children, we're talking about under 18, so adolescents as well. So 1 in 5 in the United States suffer from some kind of mental illness that really causes significant impairment. And what do we mean by that? It affects the whole family, it affects their family life, it affects their ability to attend school, it affects their ability to have academic success, to possibly have a job, to graduate, all of those kinds of things. So it's very important. That's 1 in 5. And we know that when children are affected, it's not just children, it's affecting an entire family. So it's very important to look at what causes these conditions in children and what we can do as nurses to help. We know there's multiple things. Genetic. It's just, we know depression, we know lots of different kinds of anxiety. We know there's a genetic predisposition. We're looking at, they're really looking at autism now and looking at the genetic factors. Neurobiological. There's been something that's happened, whether it was prenatally, whether it was during labor and delivery, while the patient was delivering, maybe lack of oxygen to the brain, whether it was a neurotypical child that had some sort of accident that's now affected the brain, whether it's prenatal exposure to drugs and alcohol or current exposure as a teen experimenting with drugs and alcohol. That's why I know that sometimes the laws about alcohol can be frustrating, but we do know that the developing brain is affected differently by drugs and alcohol. And so we really have to keep that in mind, especially with marijuana being legalized in January, that we think about how these drugs affect brains that are still growing. Your brain is exponentially growing during childhood. And then there's psychological factors, temperament. Some kids are just born a certain way and just have a certain temperament. Some kids are born resilient and have coping skills that others lack, or possibly because of what's happening in their house, they lack. Their temperament is affected or their resilience is affected. We know that there's multiple. This is a multifactorial issue that leads into it, and it's probably not just one thing. I think often you're probably seeing a combination of multiple factors and variables that kind of line up to cause issues. We know that children who are neglected and abused, children that suffer from bullying, if they are witnesses to violence, we know that can affect their mental health. And then cultural factors. Lots of different cultures have just different norms, and depending on what those norms are, that can certainly affect mental health as well. We know if there is severe marital discord, if there's abuse in the house, low socioeconomic status, possibly large families, 15 family members living in a one-room apartment, a parent that's in jail, we know that affects mental health as well. And, if you have a maternal or they always talk about maternal. I would say both psychiatric disorders can definitely affect a child's mental illness. And then also, foster care. So a child who, think of Maslow's hierarchy. When we think about Maslow's hierarchy, all of these things are found on Maslow's hierarchy, and all of these are affected when a child is in foster care. Think about Erickson's stages, trust versus mistrust. All of these kinds of stages that we know we have to be able to work through, these levels we have to be able to meet and to move up. Many of these children get stuck in stages that they should have been able to gotten past because of situations in their life. Neglect is the most prevalent form of child abuse in the United States, so that's absolutely heartbreaking. But why does any of this matter? This matters because we need to be able, as a society, identify children who are at high risk and hopefully step in and be able to help them before mental illness starts to be detrimental to their life, right? We may not be able to prevent them from having some problems, but we could at least hopefully be on top of it and identify those are high risk and, provide education, provide coping skills, provide basic needs for those children that need it. So hopefully if we can look at what starts it, we can hopefully then be able to step in and hopefully help and prevent as well. I want you to just read the case study and discussion. I'm not going to go over it. But one of the things we talk about is resilient children. Why are there some kids who are able, to handle things and other kids who aren't, even if they grow up in the same kind of household? Why are siblings, sometimes have very different experiences with abuse and how they process it? And we don't know. There's a lot of research right now about raising resilient children and how do we do that as a society? And is it nature versus nurture? Are you just born resilient? Can we nurture resilience? Lots of articles out there. But all in red, I've highlighted what the characteristics of resilient children are, and I'd like you to read through those. So now we're just going to look at how, as a nurse, this affects you. So when you're assessing children, one of the big things you want to make sure is you take into their where they are developmentally. So you have to provide and offer a developmental assessment, because doing a mental status exam on a 3-year-old is going to be a lot different than on a teenager. So it's very important you take into developmentally where children are when you are caring for them. Because a lot of behavior can be developmentally appropriate at one age, but not at another. A 8-month-old who cries when their mother leaves the room is very developmentally appropriate. An 8-year-old who is still doing that and is having a hard time, that's not developmentally appropriate, right? So we need to see what's causing this child to have such fear of separation at 8. We expect it at 8 months. We don't expect it at 8 years. So that's where the developmental assessment comes into play. All different types of interventions. The one that stood out to me, I think you guys can read this and understand this, but was bibliotherapy. I actually had to look that up. I hadn't heard that before. So when I read chapter 11, found it very interesting. And that's using books and stories to help children express feelings. And we see this all the time. This is one of those sort of preventative type activities that I see in the schools and the classroom a lot. Teachers use books and stories to help children understand their feelings. Children often have a hard time expressing what they're feeling or verbalizing what they're feeling. They just don't have the words or the vocabulary or the language skills yet to do that. And if you grew up as an adult and you lack that, you now have a deficit, right? But as a child, it's expected. They need to sometimes be given the right words to even explain. They don't even know why they feel sad or uncomfortable or scared or anxious. And so we have to help children with that. And one way is through books and stories. Certainly group therapy is more of an advanced practice, but we know that we see this a lot in the schools. As when I was growing up, and divorce wasn't as prevalent as it was now. When I was in junior high, I was in a divorce group. And I remember, I didn't like going to that. But I can see now in hindsight how it was helpful to be in a group with a social worker with other kids whose parents were also divorced. So we can see how when you share a commonality with other people, it can help to kind of help normalize even, validate your feelings, make you not feel so alone. Often we just want to know we're not the only ones going through something. Cognitive behavioral therapy, we keep talking about every time. This is done by a CBT therapist, and it's a way to reinforce positive behaviors through they have a process, a very specific process that they follow. So there's, when we talk about mental illness in children, one of the things we have to look at is neurodevelopmental disorders. So what causes neurodevelopmental disorders? All of those things we talked about before. Is it genetic? Possibly. There's lots of researchers trying to figure this out, especially as we see autism spectrum disorders seem to be increasing dramatically. Is it that we're just identifying them and we're getting better at it, where children before just weren't identified? Or is something in our environment? Is it the toxins in our environment? Are we triggering something in the brain function and DNA that is causing children to develop ASD? And babies, usually ASD presents by age 3. ADHD is often first picked up in grammar school. And that I want to say 10% of the population actually will be diagnosed with ADHD of children. But you have communication disorders, and I talked about that. Receptive, meaning difficulty understanding or following directions. Expressive, difficulty being able to talk or express themselves. Or social communication, just using verbal and nonverbal, difficulty with that. We can see all three of those with autism. or you may just see one of those with autism, depending on where they fall in the spectrum. A child who has had a neurobiological issue, whether they were possibly born very premature or had some sort of traumatic delivery, we can see various levels of this, as well as motor disorders, learning disabilities, etc. So this just goes into a little bit more detail, and I think you guys are able to read those. And basically, these disorders often are concurrent with diagnoses such as, autism could fall under a motor disorder. It could also fall under, it's definitely a communication disorder. It could also fall under a more of a speech disorder. So many of these will overlap based on the diagnosis of the child. So just remember, it's not black and white. You're going to have a lot of overlapping factors here. We see this with coordination disorders, often in babies born premature. And this is why some of these disorders, if we're able to get some what's called early intervention in place, they can help to minimize the effects. And that's why early intervention is huge. That's why identifying at-risk groups. We know all premature kids are at risk for communication disorders as well as motor disorders. And so any child in Illinois, I can't actually speak to the rest of the states, but any child in Illinois that's born premature automatically is put into the Illinois early intervention system, where they are, as provided by the state, given speech therapy and occupational therapy and physical therapy as a way to hopefully minimize a lot of these problems. Tics are kind of interesting. You have this stereotypic movement disorder, and really this is more of a repetitive, purposeful movement. You see this kind of with hand waving, and it has to last for more than 4 weeks. This is often seen in more of an intellectual disability, children with an intellectual, I think I spelled that word wrong, with an intellectual disability. And then tic disorders aren't often rhythmic, but they are kind of rapid motor movements or vocalizations. Tourette's is considered a tic disorder. One of the things about Tourette's that's interesting is it's often familial, so it's often genetic. We think about Tourette's in movies as being someone who inappropriately yells out profanities, and that's kind of a small percent of that. However, think if you had a vocal tic and you're trying to, think of then what happens. Your relationships are affected. Maybe parents don't want their kids to play with you because they don't understand what your disorder is. And so now you're socially becoming affected. Teachers are frustrated because it's disrupting class. And so now you're looked at as a child who is disruptive in class. And so you can see how many of these disorders can really kind of snowball into multiple problems for children. And so that's why education is so important. Early intervention is so important. Identifying groups who are at high risk for various disorders and being able to hopefully try to mitigate some of those issues with that. These are specific learning disorders. Dyslexia, we know, deals with reading. Dyscalculia is math. Dysgraphia is written. And these are disorders in the ability to how your brain processes reading, writing, and math. And in the past, a lot of these kids were just deemed stupid, right? Dumb, didn't understand. We weren't very kind to children like this. Just, I'm talking years and years ago. They were just stupid, which is, terrible. And really what we learned is that these children do not have an intellectual, often, some may, but often has nothing to do with intelligence. It's really just how the mind and the brain processes reading, writing, and math. And so now we have to really identify these kids early. So kindergarten and first grade teachers are very adept at hopefully being able to identify children who are showing signs of these disorders so that we can get intervention right away and help to get them to learn. We know that there was always stigmas attached with that in the past, again, as you're not very smart, and we know that's not true, and hopefully that stigma is changing. And again, early intervention is huge. We see intellectual development disorder and lots of different things. And this affects your daily functioning. It can affect your social functioning. It can affect your ability to problem solve. And this, again, any child who has any kind of brain damage can fall into this category for multiple different reasons. Autism to me is really interesting because it's not something I really knew existed growing up. I can look back and think about children who I was in class with who probably were autistic, who weren't treated well. And I think about ADHD in the same way. I can think of a handful of kids who probably were just ADHD, and the teachers just really labeled them as bad kids who acted out. And so thank goodness we've come a long way in that. Autism is very complex. There's a lot of research going on. We know it has something to do with how the brain is wired. If you go to page 183, the DSM-5, so do you guys remember the DSM-5 is the Bible of psychology and psychiatric illness. It is a Bible. It classifies psychiatric disorders, and it gives you the symptoms you need to have to be diagnosed with that disorder. And why is that important? Because based on your diagnosis, that is then goes into what insurance will cover and money and things like that. So the DSM-5, it's diagnostics something manual, status manual. It changed, we're on the 5th edition of it. And so this is the latest. Things change. And so it's really important that you understand the current definition. And so I want you to look at page 183. But basically, there's 3 levels. And depending on what level you meet, kind of depends on what services are provided for you. I think you guys know a lot about autism, so I'm not going to go too much in it. This is deep brain stimulation. And one of the things, and I should have actually put that in the slide, when you read about tic disorders, one of the things, if they've tried everything else, is this deep brain stimulation, which sounds awful, but it's actually can be often successful with tic disorders. So make sure you know that. ADHD, 10%. Oh, good. Oh, I misspelled there too. 10% of children between ages of 5 and 17 are diagnosed with ADHD. And it's really important that you understand the DSM-5 criteria, and it's on page 184. And I want to say for under a certain age, you have to meet 6 of the criteria, and for over a certain age, it's 5. But there is a whole range of issues that can come with ADHD. Often these kids are labeled as difficult, as not intelligent, and it can affect them socially. It can affect them in so many different ways. And we're so lucky today to have, we're going to have a speaker on this on Monday who suffered from ADHD, and then possibly maybe some of our classmates will discuss their experiences with ADHD as well if they want. Often this is found in elementary school. Oddly, we treat it with stimulants, and I honestly do not know the dynamics behind that, but you're welcome to tell me why. But we treat it with stimulants like Adderall and Ritalin. And as from a nursing perspective, what the takeaway I want you to take away from this is many kids treated with ADHD medications will have insomnia on the medications. Therefore, it's important they take it before 4 and are always using the minimum amount required. Extended release formulas are often a good idea that students can take, or kids can take early in the morning that will slowly release during the day, because that insomnia can really be an issue, as well as an appetite suppressant. A lot of these kids just aren't hungry when they're on this, and so kind of figuring out how to deal with that is important. If a child also has I spelled that wrong too, concurrent anxiety, a stimulant can actually, can make that worse, and so Strattera is a better one if someone also has anxiety, and that's approved for children actually and adults. And sometimes with ADHD and autism spectrum disorder, you may have impulsive and aggressive behaviors, and that's where you're going to look at lithium, Depakote. You're going to look at some anticonvulsants, some maybe mood stabilizers, as well as antipsychotics. You are going to see that in some children who have this sort of defiant, aggressive behaviors. But it's really important that first you're treating the ADHD to see if that diagnosis is correct. So with kids, we know it's just highly important that we are paying close attention to how we treat children. So you can go ahead and read the case study and go through that. And this just goes through more kind of information about that. And we go ahead. I would love for you just to go through, read the case study, learn about that. There is lots going on right now to try to set the standard for quality on how we treat children with ADHD. And these are some of the quality standards that were set. And this is huge. We're seeing standards of care in place for mental illness. And that's really something I would say in the past 20 years. Before, there wasn't really a standard of care. So the answer is A. At under 3 years old, it's really hard sometimes to diagnose a developmental disorder because under 3, it's hard to say. I mean, sometimes they are able to, but they usually, are they just delayed, or is this something that's going to continue? And this is B, temperament, when we look at a child's temperament. So those are just some of those words and vocabulary I wanted you guys to know. So there you go. Enjoy your Saturday.